Welcome to another episode of Health Your Way podcast, where we discuss health issues ranging from physical, mental, emotional, as well as current facts. Today, please allow me to introduce you to Dr. Sajjad Fazel, who is a public health researcher whose main focus are health promotion, misinformation, and cancer prevention. He currently works with a team of researchers across Canada studying COVID-19 misinformation and was voted in 2019 among the top young influential Tanzanians. I would like to thank you for joining us, sir. I appreciate it, doctor. Welcome.
Thanks a lot.
Okay. And I guess today for everybody, our topic is going to be we're having a conversation with Dr. Fazel on the impact of social media to the global healthcare system. And I guess this is our current pandemic, and we're realizing how big social media plays in our society. So for a lot of people that are not a big fan of social media, and there's a growing concern of it becoming a key player in our healthcare system. Doctor, should people be concerned about the changing acceptance of social media on a global scale?
Yeah, I think that's a very good question. It's a good gateway to start our discussion today. If you look at it, social media is a tool, just like any other. I normally compare it and tell people social media is like a car. You can use a car to get to places. You can use a car to take your friends around. But you can also use a car to run over people. We have had both incidents in Canada, unfortunately. And so if you have a look at it, it's just like that. You can use social media for public good. You can use it to disseminate accurate information. You can use it to engage and connect with people. But at the same time, there is a side effect of it. One is the mental health aspect, and that's a whole another ball game where people become addicted to likes and comments, and they portray themselves differently online, and so that creates this alter ego. And then the second is the spread of misinformation and the spread of myths and lies and propaganda.
I appreciate that feedback, and I know it's true because it is right. Like a lot of people, like social media is a platform. Not everything you see is what's real, right? So, I guess with that being said, there's more people that's on social media. So, with the growing change to some form of acceptance of social media in the healthcare system, what are some of the perceived challenges that health professionals face when using social media to engage the general public that you're aware of?
Yeah, so the thing is, and you're right, there's a lot of health professionals who are reluctant to use social media, but you gotta get with the times, A lot of people are online, just putting a billboard outside saying smoking kills doesn't help anymore. You need you need to reach people on social media. So what I've seen so far is there's a privacy issue. A lot of health professionals are afraid of privacy issues when interacting with patients. But there is a way around this. You can use social media for health education. So if a patient asks you, what is the side effect of this medication? Or what are the symptoms of this disease? You can respond to it on social media. There is no privacy issue there, right?
Oh, I like that.
Yeah, but when it comes to specific questions about their treatment, that's when you can say, okay, why don't we meet at a clinic or have a phone call or something that's more within the norm. So I think you can differentiate how you use social media with your patients and the public, and how you interact with the patients on a day-to-day basis. Although some of the underlying things are there. So you have to be authentic, you have to be real. So these things are there throughout. It's just that what content you put out on social media versus what content you put out when you're personally meeting a patient.
And I actually really appreciate that feedback, because I think a lot of health professionals may actually struggle with that. And then even on the side of the health professions, on people like regular people like me or listening, what are some of the benefits that they can use to capitalize on social media?
Yeah, I think. Yeah, but why you're saying why we should use social media anyway? I think there's a lot of benefit to it. So having created a health promotion program, what I've seen is that you can use social media to reach to a wide range of people. You can reach to people who don't have access to go to the clinic all the time. You can reach to people who are sort of bedridden and cannot necessarily visit the doctor's office every time. And they might have some small queries, right? For example, oh, this beeping machine is beeping. What do I do? Do I have to change the battery? Or something like, my kid just ate lemon and now he looks wonky. What should I do? There's this small doubts that people always have. And that's something that can be easily addressed on social media. The other benefit I've seen, though, is talking about things that people find embarrassing to speak to health professionals in the office.
That is so true. Yeah, I never thought about that. I like that.
Exactly. So I found a lot of people online, if they would contact me, they would contact me with questions about skin diseases, or sexual transmitted diseases, or questions like that. And these are regular questions on, oh, if something like this happened, what do I do? Or if something like that happened, what do I do? There's also issues of, and we know for a fact that certain STDs, certain mental health conditions are a taboo in different cultures. So now telling your family or parents that you're going to go visit a health professional to talk about mental health or an STD is a taboo. So I think to a certain extent, social media allows you to interact with patients and sort of give that health education on these topics.
And honestly, by you saying that, I think a lot of people that are listening are hearing, especially even from my side, that's just a huge, like, you don't even think about that, but you're right. There's a lot of like taboos and a lot of people that may not be able to go to a doctor or tell their family, but then they can do their own research on itself. And yeah, I can see this us when we're younger, or people that are like, yo, let me just look up online, what is this and what that is. Exactly. Yes, I see that. But then again, like, we know some of the benefits, but then there's also some negative side to it. Like, for example, right now we're all going through the COVID-19 and there's so much misinformation. Like, I even heard about a documentary called Pandemic, and I'm just like, how do we like, I guess at that point is, how do you get the right information? There's so much information. What is right and what's wrong? Like, that's basically what I'm asking.
Yeah, you're absolutely right. Social media has been used for bad as well. There's a lot of misinformation out there, as you said, on COVID-19. This whole documentary called Plandemic.
Pandemic, thank you.
Yeah,
I said pandemic.
Yeah. They made it as a documentary style. So it's not a documentary. They made it look like a documentary. It's just the way you shoot it, because there's no evidence or facts backing the claims that they made. Some of the claims that they made was like, wearing a mask reactivates your own virus. That is false. There is no evidence to even back up this concept at the beginning. Some of the other claims that they made is that the government is withholding hydroxychloroquine from people. Again, this is not true. If you have malaria and you need hydroxychloroquine, you will be prescribed that medication. Whether it is useful for COVID-19 specifically, it's still something that's undergoing research. And if there is no evidence or well-conducted research, then you cannot give out a medication to someone, right? So I think, so I think there is a lot of misinformation out there in general. And apart from this, misinformation has always been there even before COVID. It's just more rampant now. I mean, there's always somebody telling you, oh, drink this healing water, it will cure cancer. There's always somebody saying, oh, eat garlic, it's going to cure this disease, you know.
It's so true.
Yeah, but I think some of the things that people need to realize and take away from this is, first of all, check your sources. Who is giving that information? Or or the person who retweeted it or reposted it, where did he originally get it from? What's the source? Is it an official website of the public health agency? Is it from a well-known health professional? Again, I use the word well-known. You can have a bogus health professional somewhere tell you that, you know what, this concoction that I made works out. Unfortunately, unfortunately, there is rotten apples within the healthcare field as well, unfortunately. So look at the credibility of the person, look at the credibility of the account retweeting it. If it's an official, it's a proper official news channel that's known for fact checking things, so not Fox News.
No comment.
No, but but if you look at the credibility, at the same time, look at the way the style of the information was presented. A lot of times you'll see that misinformation uses buzzwords. They talk about things that are too good to be true, and there is no sort of scientific backing or evidence. And at the same time, I always also advise people, when you get something or when you're sharing something, see if that person shared it with a source. So when I promote information on social media, I always try to reference it with a source. So at the end of the day, you can always go back to see where I've gotten the information from. 100%. And so that adds credibility to what you present.
I appreciate that. And that, honestly, if you guys don't get anything else from this podcast, please listen to that part alone. That just, like, I think should highly be, like, I think that those words should be recorded and just be sent to everybody that keeps sending me updates of like just please make sure you have the right sources. And I appreciate that comment. And for a lot of people that are not aware, you also are founder of Afya Yako. I hope I'm saying that correctly.
Afya Yako, yes.
Thank you, sir. And it's a Tanzania's first online health promotion initiative, which was, I was guess the question, what was your reasoning behind it, and what can others learn from this actual initiative?
Yeah. So yes, Afya Yako was a health promotion program online that I founded in Tanzania. It was in the local Swahili language. So what actually made me come up with it is Tanzania has a lot of communicable diseases, right? So infectious diseases such as HIV, malaria, tuberculosis that are endemic over there. And then you have, and then at that time when I was in Tanzania until today, non-communicable diseases are rising. So you have diabetes, you have heart failure, you have obesity. So all these diseases are rising. At the same time, you have communicable diseases. Now there's several organizations, including the Ministry of Health, as well as USAID and other NGOs that help in terms of communicable diseases. But nobody was addressing chronic diseases. And we know for a fact that chronic diseases can be prevented by lifestyle management, exercising, eating a well-balanced diet, having good sleep, and reducing stress, among many others. So I saw that it is important to educate the public on this. Now, why did I choose online? Because of inexpensive smartphones and cheap internet spreading everywhere around the world, people from all over the country could tune in. And up to then, social media was used for celebrity gossip and just chit chat. So I was like, we can use this platform to reach a wider audience. And yeah, thankfully the program was well appreciated. The Ministry of Health were interested in it, and now they have their own platform. And a lot of media people are also interested in it. So the program grew, and I grew with it. The lesson to learn from that is, if you're a health professional or if you're anyone in general who has a creative idea that meets a problem or that sort of solves something that's going on in the community, just put yourself out there. Feel free to do it with all your passion, and you will become successful. Start with what the problem is, how you're going to solve it, and you'll become successful.
I appreciate that. Now, with increasing scholarly articles on the benefits of social media in the healthcare system, is it fair to say that social media will become a huge player in the healthcare industry going forward? Like, a lot of people be like, no. But in your opinion, what is your thought process?
You are right on the money. You're right on the money. Social media has become part of our daily lives. I mean, we receive updates from global leaders on social media, don't we?
Some of them are not right. Some of them are not right. Okay, but
exactly.
Some of them, okay.
But that's the thing. It has become such an intrinsic part of our day-to-day life, and it will continue being that way, that I think not embracing it is an error. And I think in healthcare, it's taken a huge role, all the way from disseminating accurate information to targeting areas where where people have vaccine hesitancy, or knowing which areas there is a flu. So I know Google Flu is a project where they track where people search more for flu and flu symptoms, and oftentimes that's how they find out which areas have more flu spreading. So you can use it, so you can use it for those things. You can use it for initiatives like the way I did for health promotion, but at the same time you can use it for research, for learning more about what goes on in people's minds, what people are thinking about, and for even conducting surveys and research that you need people's feedback on.
I appreciate that. I never thought about that, especially the whole Google part. That is interesting. I guess if viewers and listeners were interested in your expertise and wanted to reach out to you, what social media platform are you on that they can reach you out on?
Yeah, so I'm on almost every social media platform. I'm on Facebook, Twitter, LinkedIn, and Instagram. I use Twitter more than the other platforms, but these days I'm regular on everything because we have to address COVID misinformation. So yeah, they can follow my platforms. It's Dr. Sajjad Fazel on every platform, or at Sajjad Fazel. It's the same name on every platform. And yeah, they can feel free to reach out if they have questions or follow the content that I produce.
Understand. And I will have that details in the write-up for people to reach out to you directly. I guess then the question is, what's next for Dr. Fazel? Like, I know you're a very, high perceived man, highly educated. Like, what is next for you?
Yeah, I think, you see, we're all doing our part. We're all playing our role in the community. And that is sort of my core belief, that we are brought onto this world to make a positive impact, and in doing so we improve ourselves. And so I'm looking more of slowly over time shifting from core research and getting into public health messaging and public health communication type of roles. I would like to reach a point where I'm helping various organizations, health organizations across the country, in developing messages as well as having a communications strategy on how they can disseminate as well as create content and engage the public on various public health matters.
And I think that's a good thing, because I find that within this current pandemic itself, I find that at first a lot of political professions were struggling on getting their information out. They didn't know what to do. But if there's a process in place like that, what you're offering, I think that would help a lot. It will prevent a lot of misinformation and give people a certain place to get their right information, how to engage. So I appreciate your time, sir. I thank you. It's been a sincere pleasure. Honestly, I've learned a lot. And no, I have. I'm pleasantly happy I'm having this conversation with you. And again, thank you for talking to me, sir. I appreciate it.
Yeah, thanks a lot, and I really appreciate you having me on. It was a great platform to just discuss all these issues that are going on. So thanks, and everyone watching, keep watching this podcast.
I appreciate that. Thank you for joining us today on our weekly episode of Health Your Way podcast. Don't forget to subscribe, share with others, and please feel free to comment below and ask any questions on topics we discussed, as well as future topics you'd like to hear about. Have a happy and healthy week, and be sure to tune in next week for the next episode on a Health Your Way podcast.